So I would just like to give a very brief introduction about Regina ma'am. At present, she is the professor and head of the Department of Obstetrics Gynecology at PK Das College of Nursing, Vaniyamkulam, Kerala. So she is a graduate from AFMC Pune, and she has served in the Indian Army for around 23 years. At present, she is the professor and head of the Department of Obstetrics and Gynecology in the area of nursing. So in NGI, she has been working for the last 10 years, and she has involved herself actively in many social activities. She is also the president of the Lions Club at Irumapatti. She has written book chapters in nursing, and she has around 36 years of experience, including clinical field and teaching. She has also published more than 15 papers, and she has attended many national and international conferences, and she has many presentations at both the national and the international level. She is an academician as well as a very good and able administrator. She is also interested in various research and innovation activities. With this short note, I would like to welcome Lieutenant Colonel Dr. Regina to begin the session. Welcome, ma'am. Ma'am, you can start now.
Now it is unmute, no? This screen, no, ma'am? Ma'am, you can't see the screen, no, ma'am? Is it visible?
Yes, ma'am. It is
Okay.
visible now.
Is it visible, ma'am? Can you hear me now?
Yes, ma'am. Yes, ma'am. You're audible, and your presentation is also visible. You can start.
Right, sorry. Okay. Good evening to all, and sorry for the inconvenience, which is a slight technical issues have come up. And I'm very glad to present in this FDP. Thank you, Mridula ma'am, for this opportunity. Coming to the topic, this is medicine and technology, right? So by now, I think everybody is satisfied with the Ayurvedic therapy and all good sessions, right? The global pandemic has forced the healthcare industry to adopt various innovative technologies at this present time. Those days have gone in the olden days with medicine crushing and given to the patients. Now the innovative ideas and innovative technologies are on. The plethora of health technologies range from systems, devices, tools, procedures, and medication, different types of vaccines that strive hard to deliver high quality care while reducing the costs for patients, hospitals, and streamlining the operations. It is not only the technology has come up, it should be feasible for the patients and it should be affordable. Evolution of medicine and technology from traditional practices on the olden days, and it has come to the level that digital healthcare. The patient can contact the doctor when he or she is sitting at home. She can get the expert opinions from other country also. There are various changes have come in the field of vaccines, different types of medicines, antibiotics, and X-ray technology, that is the imaging technologies and all. And there is time to time advancement in the medical side. It is the revolutionized area now. Integration of modern technology has revolutionized in the medical field. The medical field means medicine. It is giving medicine, and it is other form of the allopathy side is the surgical side, operative technology. In even in operative technology, the things have come like robotic surgery. It is minimizing the effort of the surgeon who has to stand for a long time and advises and easy technology with the robotic. Technologies aid in diagnosis a disease condition to identify the patient is coming with different signs and symptoms. To identify what is the disease condition, that is diagnosis. Technologies helps in diagnosis and giving treatment to the patient and monitoring the patient each day or each second in any emergency case, emergency or otherwise also, you have to monitor the patient very closely so that any changes and the improvements can be noted. For this, we have got many type of monitoring system have come. Like for example, the patient has come with difficulty in breathing. He's not able to breathe and his pulse rate is very varying. So we'll attach the patient to a monitor where it will record the readings and all. And very frequently or very every 10 minutes or 5 minutes, you can take the strips, rhythm strips and see what is his condition. Even while observing the patient on the monitor itself, you can make out. Such things have come due to the newer technology, and it will altogether help the healthcare outcomes. Health and medicine and the technology. The emerging technologies in healthcare might range from IT tools or softwares that effortlessly eases the workflow, boosts organizational productivity, and enhances the life quality. Once the productivity and organizational things have improved, the quality of the patients, whoever is coming, and it includes not only the treatment side. Once the patient has become all right or his disease condition has subsided and he has become okay, he goes home and repeatedly the patient may be needing the review checkups and the advices which is given from the hospital for the revival and for the occupation and further what he has to do. So altogether that will improve the life quality. The brand new technology trends in healthcare include it helps in educational field, supportive, organizational, informative, and therapeutic, where the treatment can be given, and rehabilitation. For example, the client has had an accident, so there may be a limb damage or fracture. So slowly after the damage has been repaired or the fracture is been reduced, then he has to have the rehabilitative state and further diagnostic and preventive solutions. We advise the client or the patient what are the preventive methods which can be used for further not to have such diseases. When it comes, since it is you all everybody is aware that artificial intelligence is in the field of healthcare, and in this sector it allows the professionals and experts to reduce human errors and make better decisions, from identifying infectious diseases patterns to immunotherapy, which will be needing for a longer time. The patient's resistance have gone, so the immunotherapy will be required for a long time. And the radiology tools for cancer patients, the abnormal growth of the cells. So in the radiology, the therapy is that it will minimize or it will destroy the cancerous cells. So in this field, the radiology has improved a lot. And this advanced technology enables the development of more precise and efficient interventions. Means, for example, in the oncology patient, that is the cancer patient, which cell is to be destroyed. The particular cell is only getting destroyed. So in this area, AI is potent enough to impact the primary healthcare services in the diagnostic treatments, approaches, and the care process. Virtual reality is another excellent emerging technology in the healthcare sector. Some virtual reality solutions can potentially deal with heart crashes through specific cognitive behavioral therapy. Cognitive behavioral therapy, it is coming in the treatment of psychiatry. The patients who is having the psychiatric problems or depression. In such cases, in the for improving the mental health status, we use the cognitive behavioral therapy. Their meditation training allows you to manage and get relief from the pain. The healthcare sector uses VR in various settings, such as in the hospital, surgery units, during home visits, and emergency situation or emergency departments, and urgent care clinics, medical offices, telemedicine, and pop-up clinics. Here, everywhere, the virtual reality can be used. This is another improvement in the healthcare technology. What are the different benefits of incorporating the technology in healthcare industry? When the technology have improved, the benefits of introducing technology in the healthcare industry is never ending. It is not to the limited. Quick access to the medical information of the patients. These days, patients who are coming to the hospital or the clinic, they are with the symptoms itself, they'll Google and see these symptoms. Will it be this mild gastric, when is it a gastric pain or a chest pain? So they very well, they first search what will be the outcome. So they are more aware and gaining complete access to the medical information. There are different apps are available, which is the nearest hospital, which is the nearest clinic, where I should go, whether to a physician, surgeon, or neuro specialist, whatever it is. So they get complete information regarding the medical requirements, and it improves patient care. The implementation of top-notch technology is capable of increasing patient engagement quite effortlessly. It helps them to make room for wellness plans and personalized health. It is these days everybody is well aware about that. My health, I should be conscious about my health. It is not that I should be very fatty and that is the health. No, people are much aware about the diet, and as per their height and weight, they know that how much they have to take, what all should be eaten, what should not be taken, what is timing, etc. Especially in this situation, in these days, the lifestyle diseases are more like hypertension, diabetes mellitus, and it is more because of the lifestyle pattern. So when the technology is improving, patients or the clients are becoming more conscious about their health. There are different challenges which is due to the technology which is coming up. Implementing healthcare technology comes with several challenges. One is coming in the data privacy and security are paramount concerns, especially with the increasing use of AI, machine learning, and blockchain technology. To protect the data about in the medical field, it is very important to keep the safe custody of each patient's data. It should not be revealed to other unless until it is required, and protecting sensitive patient data while maintaining the transparency and accessibility is a delicate balance. Health institutes, tech startups, regulators, and the government must address the challenges such as data privacy, integration cost, regulatory hurdles, and resistance to change to ensure the successful adoption of this technology. Technology has come up very good, but securing or the keeping the data is another important aspect. This is modern medicine and technology are reshaping the healthcare delivery. Like to render the service to the patient, there is modern technology helps. Like within a phone call, you can attend the patient's requirement. Like doctor at the footstep, you can inform the medical unit or the reception of the hospital, and we have the facility to the doctor will be going to the patient's side. And if it is required, only patient to be shifted to the hospital. Then another advanced tool to improve that is in the diagnosis, treatment, and patient outcome. It helps the technology, new technology helps faster, personalized, and more efficient care. The human error or error is being minimized with the available machines and the monitoring settings. We can avoid, we can detect the problems early. If the patient is put on a machine or any gadget, it gives the alarm at times that indicates that suddenly patient's heart rate has gone high or the patient's heart rate has come down. So this alarm or these sensors give you the appropriate timing to reach to the patient to reduce the complications. These are the few important aspects of the modern medicine which the technology has improved. What is it's a telemedicine? That is remote diagnosis. Patient comes in contact with the doctor or the consultant or the expert. Patient may be in one country, the doctor may be in another country, but through the video conferencing, he can see the patient. He can directly interact with the patient. He can observe. Then it is the easy method for the diagnosis, and once the diagnosis is made at the prompt time, appropriate time, then the disease condition is recognized and the treatment can be given. In healthcare, it predicts the analysis and the diagnostic. Again, with the help of the AI involvement, the diagnosis is slightly better. It is much better rather than you are going through the symptoms, going or analyzing the symptoms and all. These days, everybody is aware that few, it is not very common, but still the robotic surgery is the precise and minimally invasive procedures, less blood splashing, minimally invasive. Patient can go on discharge after the procedure, after doing the invasive procedure, minimal invasive procedure. For another thing is that laparoscopic surgeries rather than open surgeries. For example, if the patient is having appendicitis, there are options that we can get it done through laparoscopic surgery using the laparoscope. The endoscope is inserted into the abdominal cavity, and the inflamed appendix can be removed through that. Rather, opening up of or open surgery can be minimized. Not only in the appendicectomy, even hysterectomy, cholecystectomy, and all. Like these robotic surgeries and laparoscopic surgeries are also very common these days. It is, as it is already told, the artificial intelligence helps us to detect the diagnosis, to detection and the diagnosis, especially in the cancer screening using AI algorithms. That means the cells, if there is any variation, thickness of the cell walls are getting damaged, or there is some minimal growth is so AI implemented diagnosis will be easier. So early diagnosis can improve the patient's condition by giving the treatment early, and the patient can come back to the normal life. The treatment can be started very early so that the metastasis, that means the spreading of diseases, can be minimized. And personalized treatment plans as per each patient's condition, the treatment plans can be planned and rendered as per that. It may be required the very few days in the hospital. Rest of the treatment can be given at home with the proper support and the advices from the hospital side. And to detect the complications or the potential problems which can come up, that also can be detected with the help of AI, so that the complications, if we decide, if we see earlier, then the remedies can be rendered earlier. And same way in X-rays and MRIs for faster diagnosis. In MRIs and X-rays, the digitalization has come. Gone with the days that the big X-ray films and all. Now it is digitalized, small films, which can the clear-cut diagnosis can be made with seeing the digital X-rays. This is already told. Robotic system that helps the surgeons to avoid the timing, which is taking so long. They take the big major surgeries and all. With the robotic surgery has come up, it is precise and the stability, minimally invasive procedure. It saves the time and the recovery period is fast. The recovery time is fast. Surgeon can do the surgeries, complex and very complicated surgeries can be done with a very accuracy. The accuracy is maintained. Complications are less. The recovery period is fast. Patient can go home faster, and the stay in hospital can be minimized by minimizing the stay in hospital. The infection rates also will be minimized. Next is the wearable medical devices. Everybody is aware about the smart watches, right? The smart watches, and it is giving the outcome that you can have the continuous monitoring, like your heart rate is being monitored, your what is that respiratory rate, which is 2022. If it is any changes there, it is recorded. Heart rate is also recorded. Then any changes, and there is a for a particular duration, the readings are recorded there. You can press a button and see what is my heart rate. So it gives you the alarm. Like it is okay. Is there anything problem these days? For last few days, my heart rate is going up to 120 and all. Definitely, that is more than the normal, like 80, 90 or 90, 100, more than that, 110, 120. What should be the reason? Or otherwise, in between my pulse rate is going below 60 or 50, 52, will it be a problem? So suddenly the person will think, what is that? And that is what the example is. Smartwatches, fitness trackers, and the biosensors are kept so that your parameters is being recorded. Even small machines which is coming on the SpO2 monitors, that will give you the reading of what is your saturation level, oxygen saturation level in your body. That comes in percentage. Usually 98 percentage to 100 percentage of oxygen is available in your blood. But if you are having some lung problem or breathing problem, suddenly if you put that machine in your finger and see, oh, my SpO2 level shows 70. What is that? So you wait for some more time. Again, after 10-15 minutes, you see you are having some respiratory problem, and your what is that? Your SpO2 is showing again 75, 76, means that is something wrong. So this is easily you can record at home. That is the SpO2 monitoring. Your oxygen levels can be recorded, tracked. And the fitness trackers, Fitbit, Apple Watches, and all there to monitor the heart rate and what is your sleep patterns these days. The due to the lifestyle and the sleep, what is the late night sleep and sleep patterns are disturbed. So these smartwatches or the fitness trackers will record your sleep patterns and your physical activity, how it is and all. Continuous glucose monitors, diabetes in Asia. I think India is the uh, best place to have the sweet persons. And I think Kerala is first in diabetes mellitus. It is not only the older people are getting diabetes mellitus, younger and younger. Even teenage people are getting diabetes mellitus, and girls, boys, everybody. We are on the track. We are on the trap, rather, not on the track. We are on the trap of diabetes mellitus. Like to have a continuous glucose monitoring. What should be your glucose monitor level? Like 80 is fasting, 80 to 90, and 100 up to 100 is your 100, 110 is your postprandial, that is after meals is your record. Fine. If it is goes beyond that, suddenly you're checking your glucose monitoring, you find that it is 200. Okay, that's fine. I might have had some sweets or something. Then again, once in a while, you are checking that gives another reading that very high, 300 or 320, and that is really alarming. So the continuous glucose monitoring is a real wearable medical device. I think one should have so that you can have the monitoring about your diabetes. This is again the benefit says that early detection of irregularities, that is the cardiac arrhythmias. Arrhythmias means the derangement of your pulse rate. Normal pulse rate is 80 to 90 beats per minute. So the arrhythmia means there's a derangement. Your pulse rate is not regular. It is not, it is the waves are not regular. There is ups and downs. So once you have the rates, some 1 minute it is 82, another it is 60, and another it is 110. That means your pulse rate is not okay, and the rhythm is not regular. These all things can be recorded with the wearable devices. Another thing is that some patients, we put the wearable device and we can send them home, and the record, if suddenly patient is having some chest pain, some abnormality, the control room or the console room which is kept in the hospital or the clinics, wherever it is, there we get the information that such and such patient is having problem, so that your hospital vehicle or ambulance can be sent to that particular patient, and we can pick the patient up, pick up the patient from the, and needed care can be given. These are the benefits of wearable medical devices, smartwatch, fitness trackers, and all. Electronic health record. This is because this is a high tech which is happening in all the hospitals and clinics, streamlining the patient's information very clearly, and digital storage and sharing of medical records, improving communication among healthcare providers. That like a patient, once you come to the patient, it has happened in one of the sophisticated hospital that I had been to, my one of my relatives. We were sitting in the specialist cabin. So the thing is that only you have to tell the number, the OPD number that we were knowing. So we told the number, the doctor examined the patient and all. So there is the reading of the lab results were on his computer. So I was a medical person. Being a medical person, I could see the reading. But with me, my sister-in-law, she doesn't know. Sister-in-law's son is also there. She is not knowing. I was totally worried because the lab reading, which was high, it was showing red and it was blinking. That specialist was looking at us. He was not knowing that I'm a medical person. Very badly, that boy had a uremia, that is, both the kidneys were damaged, and he has to undergo dialysis. Ultimately, we lost him. I mean to say that technology is so high that on the on your table itself you can make out what is happening to the patient, what is the reading and all. So this is electronic health record. Benefits: it enhances communication between healthcare providers and reduces the medical errors again. So the moment everything is linked to the digitally, so there is errors are minimized, medical errors are less. And again, the slight problem comes in the challenges. You can say that it is the data privacy, keeping the data privacy, and centralized digital patient records will improve the efficiency, facilitates easy sharing of data. So, like that day itself, the specialist had sent the data to the dialysis unit. By the time we took him to the dialysis unit, the data were the, so it was very easy for the patient and the relatives to handle. They don't have to carry the document as such. It reduces the medical errors and enhances the patient safety. And 3D printing in medicine, this is revolutionizing customization. That is in the application of prosthetics like limbs, artificial limbs, implants, and organ models. Future potential: bioprinting tissues and organs and bioprinting. For this 3D printer creating medical tools, how a organ or how a tissue will be there with the 3D printer. It is mainly applicable in the prosthetic, making the prosthetics like limbs, upper limbs and lower limbs. On when you make this is coming in is the form in making the prosthetics and the implants, and it reduces the production cost. It enhances customization for the patients. These patients needs how it should be, color, size, and how fitting, and so it is applicable in mainly in the prosthetics and what is it, implants. Genomics and precise medicine. It is apply genome, genetics, and sequencing to identify the genetic disorders. These days, the certain genetic orders which can be, you can identify which gene is going to cause. Suppose my in my family or some hereditary, there is a cancer breast prevalence. Prevalence means there is existence. My grandmother's mother or somebody had the cancer breast. So, do I have the possibility to get the breast cancer? So, genomic studies will reveal that such and such gene is going to cause uh, breast cancer. So, Angelina Jolie, she had removed the breast, anticipating that her grandmother had the breast cancer. She had removed. So, anticipating that, you can take precautions. You can rectify that possibility of getting what is it? Not only cancerous or oncology cases, even in diabetic and other things also can be rectified. More effective treatment, the fewer with side effects and advances, and it will understand. It will make you understand the rare diseases, like certain hereditary diseases, genetic disorders can be detected, which is helpful to avoid the forthcoming. Like if this generation is not having, next generation is it possible to have? So such advices and counseling can be given. So genomics is one upcoming field. This is the most advanced gene editing technology. These things have come up, like some gene is going to cause some problem in my future life. So it can be edited. The gene corrections can be made. This cutting of DNA is what has the power to potentially transform the way we treat disease. So cutting some portion of the DNA or strands and adding some other portion of some other DNA, this can reduce the chance of getting the hereditary diseases, hereditary problems, which is in the near future. Now the cost of the genome and the gene related therapy is quite high in recent coming up future years. This may be possible that even a layman can be approachable for these gene therapies. High resolution imaging like MRI and CT scans. High resolution means whether there is a CT scan and MRI is useful to detect any growth or any obstruction in the blood vessel or anything which is pertaining to the vascular. So this is high resolution means there is easy or earlier detection of the disease, what is happening. If CT brain has done, there is high resolution means the very small size of tumors can be detected. Then if it is detected earlier, the surgery or the treatment can be rendered at the earliest. And portable devices for quick result. These days, the portable devices are very much available. In X-rays for the sick patient is not able to be shifted to the X-ray department for the X-ray. We have the portable machines, very handy machines, which can be brought to the bedside and the X-rays can be taken. So it gives a quick result. And again, in these also, the AI assisted diagnosis is available, and it will enhance the accuracy of the diagnosis. And providing nanotechnology in the molecular level, nanoparticles for the drug delivery and potential for detecting treating diseases at the earlier stages. And the nanotechnology technology is more applicable in delivery of the treatment, especially in the chemotherapy drugs. Chemotherapy is the drug which is given for the cancer patient, particularly to destroy the cells, the drug which is given orally or injectable form through the veins. So the drug which is going to destroy the particular cells which is cancerous. So in this way, these nanobots or nano part, what is that molecular nanotechnology is being used, minimize the damage to the other healthy tissues. As if you're using this, the damage to the healthier tissues can be minimized. It improves the treatment of, again, effective treatment of the cancer patients and the precision. Imaging technology, it is already explained that is X-ray, CT machine, and MRIs and ultrasound. This is anything can be detected in the early stage using ultrasonography machine. That is full human body. You can visualize or you can detect where is the error, what is that, is there any growth, is there any collection of pus or blood is clotted. Everything can be detected through all these high-tech medical imaging technologies. And for it is all these things are for the role in early and accurate diagnosis. Once it comes to accurate diagnosis, then the treatment part is easy. The treatment can be rendered precisely and the patient will be revived fast. Once the disease diagnosis is been delayed without your facility, then the treatment is delayed. Then the patient's survival rate and improving the time period for improvement will be minimized. Then again, another thing is that biotechnology, engineering life for health, pharmaceuticals and gene editing, which is already expand, and vaccines and therapies. Everybody is aware that during the say, crisis of COVID-19, and we all have taken the vaccine. Even the vaccines has improved your potential, your stand to resist against the disease, so that your body has become immune. Certain in the childhood, we are taking many vaccines. There are different types of vaccines which is coming up: diphtheria, tetanus, everything. So measles and all, mumps, rubella, and in pregnancy stage, we take 2 doses of injection tetanus toxoid to get avoided from the tetanus disease. So this gives you the immunity, and it will any disease comes means we'll find out what could be, how can you prevent it further damage. For that, the technology of vaccines have improved. Then another thing is that stem cell research, the regenerative medicine, advancement in tissue repair and organ regeneration. We are repairing the tissue. We are remaking. The era is going to come that you are, this is if the liver is damaged, liver totally damaged, you have to get a liver from the donor and get it transplanted to the recipient patient. Now the thing is going to come, the stem cell research and are going on. Your damaged liver or kidney can be regenerated from yourself. The cells can be grown inside, and it will be much benefited that you don't have to get it from others as a donor. Stem cell differentiating into tissues. There are different apps for the mental health and the technology, technical solutions for mental health well-being. Apps are available for mental health tracking and the therapy, AI chatbots and VR therapy tools, and smartphone that will display different types of apps which you can use for the mental relaxation, reducing the stress. This is the era of full of stress, right from the childhood till the end. Everybody is stressed, whether it is a small baby, school going, or a youngster, elder, and senior most, everybody is under the clutches of stress. So the percentage of going into the depression and other complications are more. So certain apps are available. You can get the cognitive behavioral therapy and stress relaxation techniques, and all. For that, the different apps are available in the smartphone. That is again cognitive behavior therapy. And another aspect is the bloodless surgery. The moment we hear about the surgery, there is fear of losing blood. So absolute the blood will not be spilled out as earlier. The surgical techniques and tools designed to minimize or eliminate blood loss during the procedures. During the surgical procedures, the blood loss will be minimized. The cauterization, electrocauterization, when you cauterize, or rather you cut and stitch, when you cauterize or through the laser, then the splashing or the losing your blood is minimized. Advanced hemostatic agents and sealants means, hemostatic means to stop the blood. There is that is the agents or the drugs which is known as hemostatic agents, and sealants which is closing your bleeding. And use of minimally invasive technology, as earlier I told, that a laparoscopy and robotic surgery. Laparoscopy, you are introducing a endoscope, the scope which is going inside your organ. For example, if the endoscope is going to the bronchus, it is the bronchoscopy. If the endoscope is going to the larynx, it is the laryngoscope. If the endoscope is going to the uterus, it is hysteroscope. If the scope or the endoscope is introduced into the urinary bladder, that is the what is that, ureterosurgeries can be done with that. So whichever organ is affected, in that the endoscope is introduced, and it can be highly visualized, and the surgeon operates through. And minimum cut, minimum incision, through that in only the cautery and knife and everything will be placed, and the correction will be done. Reduced risk of complication from blood transfusion, shorter time of recovery, suitable for patient who is refusing the blood transfusions and all, and even cardiac surgery also minimum blood splash or blood less surgery is been getting practiced. Interventional cardiology, that is angioplasty, stenting, embolization for tumors, and drainage of abscesses or fluid collections, biopsies and catheter placement. Angioplasty, everybody maybe everybody have heard about the angioplasty. That is, if I have a cardiac problem, suddenly there is a block in my coronary artery, that is the heart artery, and it got blocked or it got clogged. So what happened is I'm bypassing, I'm putting a stent, medicated stent, and clearing the way, right? So the correction is being done. So that is angioplasty. But if it is not possible, then only this will be done through the open heart surgery. So angioplasty and stenting has become very common. Once you have some cardiac issue, that is especially the myocardial infarction, that is your blood supply to the what is that, vascular, there is a block, the circulation is not going. As the circulation is not there, means it will not reach your limbs, and so you will collapse, sudden collapse, suddenly patient collapsed and died. Or before you could reach the hospital, we could not survive. Means the earlier you reach the patient to the hospital, the corrections can be done. Here we are using the intervention cardiology. Embolization for tumors and aneurysm. Aneurysm is the clotting of the blood, and the clot can be removed through the cautery sort of the embolize, and another drainage of abscess or fluid collection. Internal organ is like a machine only, so there can be some damage, some fluid collection, blood collection, pus collection. This can be drained through the ultrasonography. You can make out where is the pouch, where is the exact, if you are having some lung problem, you are having repeatedly cough, and there is pooling of fluid inside the lungs, so pleural effusion. So exactly with ultrasonography you can detect which lobe, right side lobe, left side lobe, lower lobe, upper lobe, where is the exact location of the fluid, and you can that particular place you can place the needle and withdraw the extra fluid or whatever it is. So that there comes the interventional radiology and ultrasonography and all, and real-time imaging ensures the precise exactly where is the location of the problem you can apply. Non-invasive radiation therapy, which delivers precise high-dose radiation to target tumors. This is applicable in the cancer or oncology, particularly where exactly the problematic cell or the extra growth is there, abnormal growth is there. There precisely you are doing the radiation, especially in the what is that, in the oncology case. Oncology means the cancer patients, where exactly the problem is. So the treatment can be given accordingly, right? The technologies used is gamma knife, cyber knife, and LINAC-based systems and all. This can be this is already to rapid vaccine development and the telehealth adoption and strengthening global health infrastructure. Globally, the COVID-19 has come and everybody is shaken. So today it is a COVID-19, tomorrow it may be something else. So as the technology and the medical facilities are improving, there is arising the different types of diseases also. So it is in one way the strengthening the global health infrastructure, making awareness and doing the research work and doing newer technology, how to deliver more precisely the drugs and all, everything has to be done up. Then there should be ethical consideration, that is mainly the technology concern regarding data privacy, security in digital health, equity in access to advanced technology, and the balancing the innovation and responsibility. Technology is one side, it is coming up. One another aspect which I want to like highlight is technology is good. It's not bad. It's very, very good. It is easily approachable. Things are coming to, but the human is also a requirement in when it comes to the health care. Human touch, the AI cannot detect, or AI cannot detect certain things. The human touch is a human touch. So ethical consideration even for the data saving and all, but ultimately human touch is a must. Then another the thing is technology is under, so communities, it should be available for the innovation and technologies should be. And the cost of the technology facilities is not able to afford for the normal people, but things are coming slowly, which is coming up. It will be easily accessible for everybody. And it is the modern technology revolutionize every aspect of healthcare. It is not only the particularly in the one particular medical field or surgical field or neuro field. It's every aspect of the health sector. Modern technology like machineries and things, these are applicable. It promises the improved outcomes, efficiency, and accessibility. And collaboration and innovation will shape the future of the medicine. Modern technologies have significantly improved healthcare delivery. Definitely, that is even this because of the modern technology, community health also have improved. Earlier, sorry. Healthcare which was available only in the urban area, now these days it is available for the rural area, and even in the remote area also the healthcare facilities are getting delivered, and good outcome and patient experience is better. Continuous advancement hold the promise for even greater innovation. That support of integration of modern technology, it should be available in the worldwide. Before Next is I'll show some of the some technological advancement, especially in the field. A few examples in the field of one particular branch. Like this in all the branches, medical, surgical, neuro, and oncology, all the aspects, there are different types of machines and things are available. For example, I'll show it is in the obstetrics and gynecology. Like when it comes to the term of gynecology and giving birth, and gone all those days, earlier days, the guys or the attenders have to have conducted the deliveries at home. Now it is a high tech that the patient goes to the hospital and proper gynecologist and the facilities are available. Technical innovation result in low perinatal mortality and morbidity. The thing is that high tech has happened. Now the latest in the obstetrics gynecology is, you can say that painless labor. There are facility to have medical gases which can be used to reduce the labor pain. The patient can take the gas and it will relieve your uterine contraction and pain. Another thing is that what is that? Water birth. The lady can have, if she has got the choice, she can have the high tech of delivering in the water. You can have the water birth, which is not very common. Here the picture, is it visible? This picture is it visible? Hello, hello.
Yes, ma'am. Yes, ma'am. Yes, ma'am. It's visible.
This picture what I have shown is the black color. That is a fetoscope. Earlier there is this picture which we are showing is this fetoscope only. We used to have the uh, hello.
Yes, ma'am.
Somebody is on the mic. I think sound is coming. The thing is that this fetoscope is not much used now. Now we are using the technology. You can see that mother is near the machine, monitoring machine. What is that? Continuous tachography, CTG machine. And the thing is that it is on her abdomen. It is that the machine is tied up. That the belt is there, and the sound of the baby's sound, heartbeat can be heard. So she is happy. Not with that black color machine, black color instrument. You have to literally kneel down and hear the sound. This is very easy. the machine. Even the belt will be so lengthy, even he can move around. Even with the handset of Doppler machine also available to hear the heart rate of the baby. And this is again the same picture. This is the technology. The baby is treated incubator with facilities with the tubings and machineries. And earlier days, the change, the childbirth, that is to prevent the preterm labor. There are facilities available with the babies will be put on the incubator. You can say that, and what is that machine which will give the warmth and the treatment and the oxygen, everything is rendered at with the help of machine, and the feeding and everything is done through the tubings, and baby will slowly gain. The latest babies are surviving with even 600 620 gram. I have another experience. Sorry that I keep telling my experience. That is that, like, I have clinical experience and the teaching experience. I have so much clinical experience also, being in the army and all. So, recently, I had an experience that 620 gram of baby was born to my one of my cousin brother, and the baby is now 6 kg. Took 2 years. The baby was survived. This 620 gram baby survived within the incubator, and now baby is okay. 2-year-old child. That too, the baby was born after 25 years of infertility, different types of treatment and all. So this is again hands off and good our facility because of the technology of, even if there comes the milk banking and all. I don't know whether you have heard about it. The milk banking, the human breast milk can be saved and it can be kept in the breast milk bank, so that whenever it is required, it can be given to the newborn. This is again the technology says this is because of the family centered care. This is the technology that no need the lady to be in the hospital. He can be in the family centered center. There he can have the visitors, and doctor can go and check her parameters and all. When it is required, that time only she will be shifted to the near what is that labor room. Our setting, that Indian setting, it is yet to come, and husbands are allowed in few hospitals, so that consoling the lady will be much relief for the mother to give birth. Increasing the alternative treatment of modality. I think earlier classes, this had already happened, yoga and even Ayurveda and exercise, meditation, herbal therapies, aroma therapies, music therapy. All these things are alternative medicine which is coming up. That is inculcated into the modern technology also. The thing is that the motto is that early to home. After the treatment, any treatment in the medical field, any treatment with the modern technology and the medicines which is available, early to home. Get treated. We want to get discharged at the earliest, early to home. This is the role of fathers. That is again the newer technology. Uh, uh, then I think I'll wind up over here. This is especially the gynecological topic, and any technology which is coming up, any whatever it is, delivering the medicine, new medicines. It is not the earlier days. I don't know. You all might have heard that these days we are using only the disposable syringes, right? Disposable syringes, one use and throw it. But earlier days we were using the what is that, glass syringes, and we are boiling it and reusing it. This is a newer technology, one use and throw it. And the that is intracats, that is to take the blood and to give the IV intravenous fluid and all. We are introducing the cannula and removing the needle. When you introduce the cannula, only the plastic pipe which is going inside the vein, and the needle which is coming out, there is newer cannulas. The moment you pull out the needle from the cannula, the needle will get crumpled or distorted, so that it will not be used again. It is less injurious. You can throw it in the the particular container. Such technologies are also available. Another thing is that to find out the vein in the when you go to the hospital, one main worry is that the madams who are over there in the ward or in the emergency department, they will prick you. So painful it is. Getting the vein is a problem. Taking blood and all. So now it is the small machine is hand. The very carry machine is available beyond the that small machine. That light will come and it will show the where is the prominent vein. You can directly prick the vein. That is also that machine is also available, right? And newer technology innovations are coming up. Newer innovations are coming up, like different types of alarms. The other days, one project which is in our own college only, that project which is coming up, the students have given the idea, and it is we are under the process. The urinary bags, urine bag, you might have seen chronic patients or even other patients, or also the patient is not able to pass urine. The catheter is put inside the bladder through the urethra, and the bag is connected, the plastic bag is connected. In that, the urine will be getting filled. So we have to remove the urine as it gets filled. The moment it gets filled, it should not revert back. That what is that ascending type of infection should not happen. So the children have found the students have told that they are going to keep a sensor near the bag. The moment the bag is getting filled to particular amount, it will give the alarm, so that the bystander on the person whoever is on duty, they can empty the empty the urinary bag, so that it is more convenient to the patient. No need for waiting till the end and it is getting spilled or whatever it is, right? So such things are which is coming up. And there are another technologies shifting the patient from one bed to another bed, shifting the patient one bed to the other wheelchair, and etc. There are many technologies, many devices are available. These all are because of the newer technologies. And delivering the drugs, the drugs which can be delivered through the infusion pump. You can put the machine, put the drug with proper solution mixed up, and it is put it in the syringe, and you attached with the infusion pump machine, and adjust it how much ml per minute it should go. Suppose one drug has to go 1 ml per hour, I can put the reading at 1 ml per hour. You set it, then you don't have to worry. Full 50 ml will go in 50 hours. So it's very easy. This is another technology. The moment before that 50, like 40 or 45 ml, it will give you alarm or beep, so that the staff can recognize that my infusion pump is getting emptied, so I should refill it, right? So another thing is that warning signs that can be detected by the monitoring machines. The warning signs are given, beeps and sounds and lights and all. So these warning signs is very easily available. For example, another technology is it's not it is earlier also it is available. 4 or 5 patients are kept in one particular area, and these 5 patients are connected to one big monitor which is kept in the central system, central room, where is the main hall or main room where the nursing personnel are there. So the 5 machines readings are coming in that big machine, big monitor. Bed number 1, 2, 3, 4, 5, and all. So easily you can detect. Oh, bed number 2 is having some problem. That the ECG is not okay. You can immediately rush to the bed number 2 and attend to it. Like this, technology has improved. Earlier, we may have to go to that particular bed and see how and why and how what happened, or how is the patient. Now the monitor itself will give you the reading, and same way precise way that technology which is coming in the what is that drugs and all. These particular doses and all, it is available doses. If you want to small quantity, small amount of drugs are coming. You want large quantity available is coming as bottles and vials and ampules and ampule cutting machines. All these things are available. So technology, and the technology is n number. The future is so bright. it is again to come up. Let us hope that things will be easier and the common man can approach to it, and the health industry will be blooming with all the newer technologies, not only in particular field, especially in the medical, surgical, gynecological, obstetrical, neuro area, and cancer, that is oncology treatment, and genetic. When it comes to the terms of genetic, certain congenital diseases can be minimized, like autism, can be minimized if you can treat with the genetics. If the genetic therapies are coming so popular, then it can be minimized. The people will be much benefited. And educating the public about the health and the facilities which is available to us, that has to be done up, so that the so many things can be done up at home itself. The minimum things that how to modify your lifestyle and how to get the treatment. What is the importance of continuing the medication as per the doctor's advice, etc. These are also part of the what is it? Technology. That is a part. Imparting the knowledge is also a part. So with this, I'm winding up the topic. Thank you all. Thank you for listening to me. Thank you.
Thank you so much, ma'am. On behalf of the Department of EC, I would like to sincerely thank you for accepting our invitation, ma'am. Your presentation was very informative. It gave us a very clear and wide insight about the various technologies and devices in the medical field today. So I'm sure everybody here today would have gained adequate knowledge about the existing medical science and its associated techniques. Thank you so much, ma'am. Ma'am, any queries, participants, any queries from your side, you can raise it now. Sir, who's this, sir? Your voice is not audible, sir. Sir, can you come again with your query? Any queries from the participant side?
Excuse me, ma'am.
Hello.
Hello.
Yes, sir. Yes, sir. You can go ahead.
Ma'am, please tell me, if the pulse rate is normal, does it mean that heart is functioning normally?
Not exactly. Pulse rate may be normal. The patient may be having pain, or it may not be revealed. It's not always. Even the pulse rate is okay, 60 or what, or 80, 80, 82. But the rhythm may not be okay. Then that is a problem. You cannot say that if the pulse rate is okay, means everything is okay. On an average, it's fine. Your pulse rate is 82, 80, 82, 84. It's okay. Unless until the patient is having some type of symptom.
Okay. And is there any relation between the pulse rate and the blood pressure?
Yeah, definitely. Sometime. Like when the blood pressure is high, like if I'm having my blood pressure 150 by 90, that was, I'm hypertensive, right? My BP is more, right?
Yeah.
So at the same time, your pulse rate can be in the normal level, or it can go into lower level also, 60, 62 also. Another aspect, different disease condition, it differs, sir. Sometimes there is tachycardia. With the hypertension, there can be pulse rate can go high.
Okay.
Pulse rate can be high. That term is known as tachycardia. Same time, there can be blood pressure can be low. That is hypotension. So it varies.
Okay. 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 Thank you, ma'am. Thank you.
Thank you, sir.
Yeah, good evening. Can I ask a question?
Sir.
Yeah. So It was very informative, I would say. A lot of information was pumped in your close to 1 hour talk. Very nice. Thank you so much for that.
Thank
Now,
you, sir.
one of the things which I noticed during your presentation is regarding the some of the devices like this, let's say the smartwatch device, for example, with applications through which we can identify um, the blood pressure, blood sugar,
Sir.
pulse rate, etc. So
Mm.
my question is, there are many kind of applications in this Android watches as well as this, say, Apple watches. But how much these applications are reliable? Do we have a validation with the usual medical procedure with whatever output that we are getting? Like, for
That
example,
is
sleep cycle, etc. Yeah.
there is a minimum. There is a error is minimum when you say, like, for example, if you record the blood pressure with the sphygmomanometer, the manual, you might have seen that machine, that lengthy machine, no, sphygmomanometer, and the digital blood pressure monitor. There is hardly 3 or 4 variation, not much. There is not much. With the variation is very less. It is reliable. And many hospitals are following these smartwatch sort of devices to the patients.
Mm.
So it is reliable. Error is, I'm not telling that 100%, but it is minimal. That error is minimal.
And the question is, do we have some documentation regarding the validation of these smartwatch?
That I have
applications?
to I have to check up, sir. I have to check up.
Yeah, why I asked the question is because I heard from many people that the sleep cycle, etc., the BP, etc., which
Sir.
they are getting from this smartwatch devices, the applications, and what they check with some
No, that is a variation.
medical lab. There is variation. Yeah, that's why I asked the question.
Okay, sir.
If somebody can do some research upon this, that would have been great.
I think we should take it up. That's a good idea, sir. I think we must take it up. Being in the medical profession, we can do a research on it. How much is the difference, actual and what is the reliability? What the patient has got and what is exactly, right? I think I'll think about it. I'll tell my seniors to and do it, or we'll think about these research topics. Thank you, sir. Thank you for giving the insight.
Thank you. Because there are a lot of instrumentations now available
Yes,
in
yes,
the medical field,
yes,
biotechnology part. So we
biotechnology
need to be
department.
more, yeah, unless we have a validation part, we have to be a bit
Valid.
careful.
Right,
Because
right.
end user may be just using that as such.
Yes, sir. And people are worried also. My pattern is like this. What is happening? That you are right. Think about that research. Thank you, sir.
Thank you.
Pranav, ma'am.
Hello.
Pranav, can you hear me, ma'am?
Yeah, hearing.
Ma'am, my question is, the average lifespan of Indian society is declining. Is it so? What is the reason behind it? And what are the remedial measures we have to take?
Average lifespan is declining. That itself is a great topic. This is Udaya Suryan, right?
Yes, ma'am. Yes, ma'am.
Udaya Suryan, that is a big question what you are asked me. And one main reason may be your lifestyle. You yourself, you are the cause. I am the cause. I myself is the cause. Because of your lifestyle, it has declined to some extent. And your thought process, your 5H. If I go into that, if you have the 5H with you, H, capital H, shall I just tell it, Kirtana? That is the 5H. That is say hello to all, hurt nobody, healthy food, right? Healthy food, happy life. All these H, you are not following. You are not inside to inside. Each one is less happy, right? Because of your working field or you yourself. So that is one reason. Another reason is that maybe pollution or
Yes,
that is one. another reason, pollution, and things
Okay.
which you are consuming, like whatever is, you are not so particular about that you'll have food from home, only from home. No, we take from outside also. So there are many factors which is causing your decline. Earlier days it's not that I eat well, I do my work, right? They work in
Yes,
the field and all, they are not using machines. For
yes, ma'am.
example, now I don't know, like grinding machines I'm not using. It is very easy to use my mixie only. I don't want to wash my clothes on the stone outside. I will
Yes,
wash in my washing machine only, or I'll tell my servant to see, please wash it. So this is both a side, no, right? Technology has come up. Is it causing a threat to us, or is it for us? We have to think about it.
actually, the
The
science and technology should increase our lifespan. No, but why the technology, science and technology is declining our lives?
declining again, topic for research, I think. Again, again topic for research, why it is declining in spite of the moment the hospitals, many hospitals have come up with so many facilities. As such,
Yes,
the
ma'am.
diseases have increased, right?
Science increases means we have to decrease the effect of disease should be decreased. No, but it is increasing.
Why can't we think in another way? There will be more innovations which is coming up. Newer technologies will come up. How to beat that? How to beat this disease? So that may be the reason that's again our lifespan is getting going down rather. And
Yes.
if you follow that 4H in the life, I think we can be slightly better.
Okay, ma'am. Okay, ma'am.
Thank
Thank you,
you.
ma'am.
Thank you.
Thank you very much, ma'am. Thank you very much, ma'am.
Thank you. Thank you.
Any other queries?
Hello, ma'am.
Hello.
Please throw some light on one thing. Can exercise reverse blockages in the vein?
To as per the instruction of your physician. If
Yeah, my question,
revert the block, right?
can it reverse? Yeah, can that block be either dissolved or removed from the vein by means of
How,
exercise by having
doing the
correct?
exercise. Hello, your question is that by doing exercise, will the block can be reverted, right?
Yeah,
No, the block is already there. You mean to say that in that time you have to remove the block. For that you are going to do the exercise means it will worsen. You have to clear the channel first.
yeah,
Block means the blood supply is not going through that area, right? Heart is not able to convey. There is the canal is blocked. The dirt has to be
yeah.
removed. Unless until you remove it, you are doing on exercise. That will worsen the condition. We may not be able to save that patient. Like another example, don't think that I'm just telling. I have so much experience. Like other day in the church, one person collapsed the church. So immediate, he was totally sweating and collapsed, no pulse, nothing is there. So immediately we shifted to the ambulance and I started doing the CPR, chest compression. One hand holding the stand of what is that ambulance, and with one hand I was pumping. Somehow we could save the patient. After reaching the hospital, the doctor said that it is because madam had given the cardiopulmonary resuscitation, patient survived. Only 3 blocks. One was 100%, other 2 blocks were 70-70. The patient
Oh,
underwent open heart surgery and revived, thanks to God. It's not me but I could do something that I could make the patient to reach to the doctor. So you cannot go for exercise that time. That was a condition. When there is a block, it has to be rectified. That there should be clearance. The clearance has to be done. whether it is medicated stent, open heart surgery, or whatever it is. That is that.
Okay. That means once the fat deposition occurs, that will stay there
Fat
permanently.
Permanently, it has to be removed. Certain drugs, if it is a mild, like 20-30%, very less block means it can take the collateral. I mean, it will take a bypass. No, if there is a traffic block, we'll go through some other route. No, like that, it may take up. But it is more than 50-60% block means you have to remove it. You have to put a stent, medicated stent, drug eluting, drug delivering stents and all. You have to do that.
Okay. Thank you, ma'am. Thank you very much.
Thank you.
Hello, Regina ma'am. Regina ma'am.
Hello.
Yes, ma'am. I have a doubt. See, you mean to say we cannot revert the block, right? But by through exercises, you can prevent the blocks coming into it. Is that
you are right? That is right. You can prevent it. You are you are not even done any exercise. You are not working. You are every time is by vehicle only. So you are not taking care, right? Your body is not used to any exercise. So such person, the fat deposition or cholesterol deposition is more. Chances for getting clogged in is more. So by doing exercise, it is a preventive measures not to have the block. That is right.
Okay. Or can you suggest that when a person is on statin tablets, they will not have a block?
Still people are having with the statin.
Even with statin, there are chances for getting a block?
Yes, atorvastatin, simvastatin, or whatever it is, still having.
Okay. Thank you.
Any queries? I think there are no more queries, ma'am. Can we wind up the session?
Yeah. Thank you.
Okay, ma'am. Thank you so much, ma'am. The session was really informative. Thank you, ma'am.
Thank you.
Thank you,
so
Regina.
much. Thank you, Mridula madam and the team for giving me this opportunity.
We'll meet again in the next.
Yeah, tomorrow, no, ma'am.
Yes, tomorrow.
Yeah, okay. I'll
Thank you.
Thank you so much, madam, and all the audience, and for the inputs. And it's a good topic. I got it for a research.
Thank you, ma'am. Thank you.
Kirtana, we can wind up now?
Yes, ma'am. Okay, participants, the link for the feedback and the attendance is